Weighing in on a heavy problem, childhood obesity in South Carolina. Today, about 1 in 3 American kids and teens is overweight or obese, nearly triple the rate in 1963. Childhood obesity is now the #1 health concern among parents in the United States, surpassing drug abuse and smoking. South Carolina is one of the worst states in the country for extremely high rates of childhood obesity. More than 1 in every 4 low-income children, ages 2 to 5, are overweight or obese in South Carolina. If current trends continue, 1 out of 3 children born in 2000 will develop type 2 diabetes, primarily due to a poor diet and lack of physical activity. Currently, there are no after-school programs, elementary or middle school levels, that directly involve parent and child nutrition and activity education and counseling in South Carolina. I would propose creating after-school programs involving the parents and children together that teach and educate them both on the importance of healthy eating and physical activity. Among children today, obesity is causing a broad range of health problems that previously weren't seen until adulthood. These include high blood pressure, type 2 diabetes, and elevated blood cholesterol levels. There are also psychological effects. Obese children are more prone to low self-esteem, negative body image, and depression. The percentage of children aged 6 to 11 years in the United States who were obese increased from 7% in 1980 to nearly 18% in 2010. Similarly, the percentage of adolescents aged 12 to 19 years who were obese increased from 5% to 18% over the same period. Greater attention needs to be paid towards the involvement of parents and children in the education of healthy eating and physical activity in order to reduce childhood obesity. Creating a program at schools in South Carolina that encourage parents and children to eat healthier and exercise together will lower rates of obesity. This program would be bi-monthly and free to all parents and students. It would include presentations by trained health specialists and nutritionists on healthy snacking, grocery shopping tips and tricks, ways to exercise together, and small, inexpensive cooking demonstrations and physical activities. Along with the program, parents will be given short books with all the information that was provided in the program to take home and review. Parents will be encouraged to keep a food and exercise log to keep track of their meals and physical activity and report back to the next meeting to see what areas need improvement. There really aren't any after-school nutrition programs that involve the parents and children. The only other source like the one proposed is the Eat Smart, Move More, Grow Healthy toolkit. It is an easy-to-use resource for child care providers that provides skill building and educational activities for the classroom and home, and resources and tools that address the environment and policies and practices within the child care center. Since we have not seen a decline in childhood obesity, it is imperative to find an alternative approach. The reason this is not necessarily the best idea and most effective way to reduce childhood obesity is because there is no guidance. Sending home a brochure with your children to give to their parents is not going to truly teach them hands-on how to eat right and exercise. Having parents and children come together gives an outlet of interaction and communication. This is why having a program for everyone to come together would provide community support and create a great learning environment. In conclusion, childhood obesity is a major public health problem that needs all the attention it can get. That's why recommendations that focus on small but permanent changes in eating may work better than a series of short-term changes that can't be sustained. And starting these changes in young children can prevent a very large problem. The program proposed would help do this. The importance of continuing these lifestyle changes well past the initial treatment period should be emphasized to the entire family. The healthiest way to change weight is gradually, and by giving parents the proper tools and information to begin with, they can prevent other physical and psychological problems associated with obesity in their children. The policy brief will be sent to the South Carolina Department of Education and the School Nutrition Association of South Carolina in efforts to educate them on the benefits of the program and encouraging them to continue taking action in reducing childhood obesity.